Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide an update on the COVID-19 pandemic for the week of November 5th, 2020. The numbers are pretty straightforward. There's been almost 50 million reported cases around the world and 1.25 million deaths. About a fifth of them have been in the United States, with 242,000 deaths reported so far. COVID-19 is one of the top 20 most lethal pandemics in recorded human history and remains the third leading cause of death in the United States this year. In our region, Tennessee's had 3,500 deaths, Virginia's had 3,700 deaths, and Northeast Tennessee and Southwest Virginia about 473 deaths. I'm changing. Historically, I've used the Appalachian Highlands, which is a larger region, but I think it's worth focusing on these counties that are right here in our immediate area. In the last couple of weeks, I've told you I'm paying attention to four major issues: the continued spread and growth of the pandemic, the change of the pattern in Europe, reports questioning individuals getting reinfected or waning immunity, and then the increasing lack of public confidence in federal regulatory and public health agencies. This week, I'm only going to focus on two of them. The growth of the pandemic globally, particularly concerning the increase in week-to-week growth rate, 5.4%. As I've pointed out before, I like to follow the weekly growth rate because it tells me how fast the epidemic is growing. So if you have 100 deaths one week and you have 110 the next week, that's a 10% growth rate. And you can see that the smaller the growth rate, obviously the longer it takes to double, which means the pandemic is slowing down. But what really worries me is after dropping fairly quickly from April to May, the week-to-week growth rate has been slowly creeping down until this week. We've had a 5.4% increase. If you look at it in a bar chart, you can see that we haven't had this high a rate of growth since early August. It's been coming down ever since then. If we narrow the focus of this just from June to the present, you can see that, again, looks like the growth rate has been coming down, then it leveled off, and now it may be picking up. That's a real concern to me. Because at 5.4%, we're going to hit 2 million deaths in about 9 weeks. Of course, if the number is going up, as it appears to be, then we would hit that number sooner. So what's going on? There's two possible explanations for this. One, the pandemic is spreading into new populations, or two, it's accelerating into previously impacted populations. Well, in July, these were the top 20 most impacted countries in the world in terms of death per million. We color-coded them so that white was Europe, red was South America, and blue was North America. If we do the same list today, there's a couple of important things to notice. We'll color-code them the same way, put them side by side. And what you can see, increasingly, we're having spread into South America. And consistently, every single country that we look at is seeing increase in numbers. So in some ways, it is spreading into new populations. But what really worries me is the spread into previously impacted populations. Over the last couple of months, I've used Belgium as an example of a country that seems to have a mature pandemic. After starting in late March, it then seemed to level. It grew very quickly, then leveled off. But now in the past couple of weeks, it has been going up again. You can see this graphically in the case of new cases and in daily deaths. But what really worries me is the percent week-to-week growth rate, because Belgium was below 1% for weeks, in fact, months, or well over 5 months. And all of a sudden, in the last couple of weeks, it's gone up to 9.4%. This is a really bad increase. And we see the same thing in the four most impacted European countries: Belgium, Spain, United Kingdom, and Italy. We don't know if this is because of one of two different reasons. One, it could be simply they were locked down so well that when they open up, people are starting to get infected. But it could also be that this is a new set of infections, either because of a mutation or a new wave. And we really have to watch this very closely because it has implications for the U.S. In the U.S., we've seen this steady growth rate. The percent week to week seems to be about the same over the past couple of weeks. Again, if we focus just from June to the present, you can see that We went up, we came down, we went back up, we've come back down. Now it seems to be leveling off, maybe creeping back up. If this is the pattern that we saw in Europe, again, or worldwide, then we may be seeing a more rapid growth rate in the near future. At 2.6%, we'd expect to hit 300,000 deaths by early January, on January 13th. We are not seeing the resurgence in growth in our four most heavily impacted states, New Jersey, New York, Massachusetts, Connecticut. Rather, what we're seeing is a spread into new areas. So this is where all the cases in the U.S. had been as of August 13th. Now I'm going to show you where the cases have been in the last 2 weeks alone. And what you can see is the Northeast and the Southwest and the Southeast seem to be opening up, clearing out a little bit, and then it's like this wildfire moving into the middle part of the country and the northern part of the country. This is where all the cases in the previous 2 weeks had been as of July 24th. And if we put this into motion every week, you can see where the cases are. Keep an eye on Alabama there for a second. You see it exploding. And then slowly it seems to be clearing out of the east, northeast, and west, and then accumulating in the upper Midwest. In our region, Virginia has a low week to week. This week it had a high one. It seems to be bouncing around a little bit. But again, if you look at where the cases were as of August 13th versus the last 2 weeks, what you can see is it started in the peri-urban areas and is now moving into the rural areas. Tennessee, of course, has always had a higher growth rate. But again, if you look at where it was as all the cases as of August, again, in the peri-urban areas, in the last 2 weeks, again, moving into the rural areas. If you combine these two maps, you can see that our region is being especially heavily impacted. If you look at the Appalachian Highlands, our region, in the last week, we've had an 8.4% growth rate, which means we would expect to double the number of deaths we had by the first or second week of January 2021. So the bottom line is it is spreading widely. At the current growth rate, we would expect the worldwide number of deaths to double in 13 weeks. But if the growth rate is increasing, that means it's going to be growing faster and we could be doubling sooner. 6 of the top 10 most heavily impacted countries are now in South America, but Belgium has moved back into the top place. The U.S. is 7th in the world, with most of our growth being in the northern rural states. The U.S. accounts for 1/5 of the global cases and deaths, even though we represent only about 3% of the world's population. There appears to be a significant and growing resurgence of deaths in the most heavily impacted European countries, but we're not yet sure what that resurgence is. We are not seeing a comparable resurgence in the most heavily impacted places in the U.S., though it may be a little bit early. What we saw in Europe is about after 5 to 7 months after the first growth, we're starting to see the second growth. Because we started a couple of weeks later than Europe, we may be seeing this resurgence in the next few weeks. We have to keep an eye on it. Our region appears to be one of the most heavily impacted parts of the U.S. right now. We expect doubling by the next couple of months. So for the moment, we have to do the things we know work. Avoid unnecessary crowds, wear masks, engage in social distance. That means minimize the time, minimize the distance, implement good hygiene, stay home if you're sick, conduct widespread testing and contact tracing, pay close attention to quarantine and isolation, protect the elderly and those with chronic conditions, and keep following the data and change our thoughts and actions as new information is available. And let's see if we can't rebuild trust in our regulatory and public health agencies. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let Jan Stork know. It's storkj@etsu.edu. As always, thanks to Melissa White for updating many of these slides and Dara Young for editing, producing, and posting this video. If you have any questions, please let me know. I look forward to hearing from you. Thank you very much.